everyone, welcome back to my channel. So my name is Melissa. I'm trying to make sure that the live has started. Hey everyone, welcome back. My name is Melissa, and welcome back to my channel. So today I'm going to be talking about the myths and the truths around hormone replacement therapy, which is medication or treatment that is used to help with menopausal syndrome, menopausal symptoms. After I did the session was it 2 weeks ago, I had a few people who were messaging me and pretty much putting in their thoughts or their opinions around what they had heard around hormone replacement therapy. And I had a few conversations with other people after the video, and again there were some things that they thought about that were not true, and those are the things I think that I would like to have addressed today. So if you missed last week's video, please make sure you watch it. You'll find a link somewhere around here, or you can watch the whole playlist if you want to know more about healthy eating. But then if you don't know much about me, so I'm a nutritionist. My areas of specialty are weight loss, diabetes prevention, as well as menopause. So I like to raise awareness about diabetes prevention and also weight loss in menopausal women, and also just raising awareness around menopause in general. So last time we spoke about what menopause is, what the signs and symptoms are, and some of the things that could help. So what you could put in place to help with managing the symptoms. They're all different for everyone, so depending on your genes, depending on your lifestyle, the medication you're on, health conditions, it's all going to affect us very differently. So I'll dive straight onto now to the point where you're going to meet with your GP. So maybe you've noticed that there has been changes in your periods, maybe they've gone longer, or maybe you're having a short period of time, or they're inconsistent some form of way. Things have changed and now you're at a point where you're seeking help from your GP. So the points of discussion, so these are some of the things that your GP is meant to discuss with you when you go and you talk about your signs and symptoms, you suspecting that you might be menopausal. So they can discuss with you the stages of the menopause. So there's naturally 3 stages that we spoke about last time, and the common symptoms of the menopause. So again, if there's some things you've highlighted, they can go through that with you as well, and how it's diagnosed, so what they can do to diagnose, to make sure and just to double check that you have reached the perimenopausal or the menopausal phase. The lifestyle changes that can help to the health and well-being. Again, that comes down to the knowledge of your GP. Just like nutrition, not every general practitioner is going to have the nutritional education, and that's the same thing with menopause. Not every general practitioner is going to have the knowledge around your background or your cultural foods. The advice tends to be very generic, and it might work, it might not work for you depending on your lifestyle, but they can still go through that with you. Just in general, they can talk about the treatments that are available and that probably be more suitable for you depending on your background and the benefits and also the risks. So it's not expected to be a one-sided conversation, but it's meant to be, okay, this is what's available, this is what's there, this is what we can offer you, but however, these are the risks that can be associated with that treatment. So when you make a decision to take any form of treatment, at least you've made an informed decision. So I know they only got 10 minutes, 50 minutes max, I think. So it's not enough time to go through everything. Some will probably give you further information, whether it's a leaflet, a booklet, or refer you to a website. And also they're expected to talk to you about how menopause is going to affect your future health, your life. As we might have previously mentioned, or we spoke about it last time, that menopause can lead to bone loss. So women can lose up to 40% of their bone. So their bone health is affected, so that can lead to osteoporosis, osteoarthritis, bone fractures, hip replacements. It can lead to weight gain, different eating habits, and in some cases high blood sugar levels, high blood pressure, stress, depression. So your life changes tremendously, and they can talk to you about this. So as we mentioned last time, that medication is suggested to be more effective than supplements. So your doctor will now discuss the best dosage for you, depending on, any current health issues, any family history of heart attack, stroke, etc. You won't really need blood tests, but your doctor can check your blood pressure to just make sure everything is okay. Just be aware that some doctors and healthcare professionals, they still believe outdated reports that hormone replacement therapy is linked to cancer, it's linked to blood clots, it leads to heart problems. So they can be quite reluctant to opt to prescribe the hormone replacement therapy. However, it's important to mention that this information is actually from a flawed study. So the women that were in that study which produced those results were actually older, so they didn't cover the most women, so with the younger women, the middle-aged women, the older women. It was just mostly older women, and also many of them were obese, so that means they were also at risk of heart attacks, heart problems, blood clots, and cancer, because obesity can be a risk factor to some of these issues. And also, these women, some of them had history of cardiovascular disease as well. So when the results came out, actually they leaked before appropriate tests were done, and the type of the treatment that was used in that study, which was done in 2002, is not usually being prescribed today. Also, in that study, they were receiving high doses of that treatment of the hormone replacement therapy. So some things were not done properly, and the data was leaked before they could proper look at the data and the information that was in front of them, and that gave false notion or false information or false conclusion around hormone replacement therapy. However, lucky enough, the data was looked at properly and the right tests were carried out, and their findings were actually the opposite. However, it's important to know that there's no medical reason why hormone replacement therapy should be unsuitable for you. So you can speak to your GP, and you can also seek second opinion. So if you think maybe a GP has, different beliefs or views or opinions around hormone replacement therapy, speak to someone else. You could speak to another healthcare professional at your surgery, so maybe book another appointment, or you can ask to be referred to a menopause specialist. They are there now. So there's also private menopause clinic. So there's an organization called British Menopause Society. So what you have to do is you search bms.org.uk and you put in your postcode, and you can find menopause specialists that are registered, whether they're NHS or private. That way you can get that second opinion. So we spoke about how there's different types of hormone replacement therapy. So the best one is the one that has got the regulated bioidentical hormones. So it's got the same hormones that are naturally produced in our body, and it comes from a root vegetable called wild yams. The yams? I know there are some African populations that eat yams quite a lot. So these hormones, or this vegetable, it's got some hormones in them that mimic the ones we produce in our body, and they are put in a pill or in medication, and they just help to relieve the symptoms by balancing the estrogen levels that are inside our body. Because what happens is, as women, as you start getting older, that estrogen levels, they drop tremendously, although we've got other hormones that drop as well, but estrogen is mostly affected. So this is when the bioidentical hormones come in. So be careful when it comes to private clinics, because they may use hormones that are not licensed or even regulated. So again, that's something you need to double check whenever you prescribe something. Make sure you check if it's licensed or it's been tested enough. So you can get estrogen hormone replacement therapy, or you can have one that is combined. So the estrogen hormone replacement therapy, it comes in as as pills. You can put on the skin as a skin patch, as sprays, as gels, and it's a trial and error basis, but the GP will discuss the best option for you. So for example, if you're a person who's quite active, maybe you sweat a lot, your body is moving quite a lot, that's going to affect, for example, the patches. And maybe pills you tend to forget, or maybe at risk of strokes and heart attacks. And sprays, it just comes down to the skin, and everything else is the same way as gels. So again, not one fits all, not one shoe fits all. You've got to try and find something that works for you. And the GP will be reviewing all that in every 3 months, until you find something that's best for you. So the treatment can help with, the symptoms, the hot flashes, the night sweats, the low moods, and also there's about over 35 symptoms. So these are not all of them, but these are some of them that I've mentioned. And the added bonus of the treatment is it actually helps to protect your bones. Remember, we've mentioned that as a woman is going through menopause, there's just so much that's going on, and estrogen, it helps with how strong your bones are. So if the estrogen is dropping, or that hormone is dropping, you start losing that bone at a very, very fast rate. So having that medication, it helps to protect that bone loss, so that it replaces the estrogen to help you not to lose as much bone. And also, as we mentioned, that there are some health conditions that can come with menopause. So for example, cardiovascular disease, heart attack, strokes, type 2 diabetes, clinical depression, dementia. These can be some of the side effects of menopause. And again, treatment can help slow down the rate at which you can get these conditions, or even avoid it completely. So you can take the hormone replacement therapy medication for as long as you need. The symptoms should start improving within 3 months, and for others it can actually be quite quick. But you can discuss this with your GP or your nurse at your review. And some may ask, what happens if it doesn't work? So you may need to talk to your GP about how you're applying the product, for instance, adjusting the dose, maybe the type of hormone replacement therapy you're on, if you continue to have symptoms after the first 3 months of taking it. But also be mindful that it is common for symptoms to kind of get better and then get worse again. And but then that's a sign sometimes, especially for example, if you can start bleeding when you start taking the hormone replacement therapy. But then that's a sign that maybe something is happening, and it will settle. There can be side effects that your doctor will talk to you about, such as tender breasts, headaches, unexplained vaginal bleeding. But please be aware, do not worry, it will settle eventually. And some of the myths around hormone replacement therapy, you might have heard that it comes from horse urine, and that was a long time ago. It's not being done now. As I mentioned, it's coming now. It's being sourced mainly from the wild yam plant, the root vegetable. Okay, so it has the estrogen it produces has the same structure as the hormone that is produced by our body, so it makes a massive difference. And also, estrogen alone is associated with no or even a lower, very, very, very low risk of breast cancer. However, you've got the one that we mentioned that contains both estrogen and progesterone. That may increase the risk of breast cancer, especially if you're taking it as a pill. But then again, that's something your GP will discuss with you in terms of the best way around that. But they normally suggest that you can reduce the risk of, for example, strokes or blood clots or anything like that by using the patches, by using the gel, by using the spray form. That way, the medication you're taking is not passing through the liver, because the liver is the one that creates the clots. So if you are at a higher risk, maybe a different form of the medication might actually help. And you might need to be referred to a hematologist. So these are doctors who specialize in blood conditions before you take any hormone replacement therapy, if you are at risk of, or if you've got strong family history of blood clots or stroke and anything else that can, affect your health. So if you start your treatment before you're 60 as well, that's another thing that you need to factor in. It doesn't increase your risk of cardiovascular disease. It doesn't, the treatment does not affect your risk of dying from cardiovascular disease. Tablets, they can raise risk of stroke, as we mentioned. However, it's very low in women that are under 60. Okay, so it comes down to individual circumstances, but your GP is meant to give you that detailed information. If they don't know, they can refer you to the person that can help best. All right, so again, hormone replacement therapy do not worsen your heart condition, do not worsen your bone health, but instead they actually improve the strength of your bones, your muscle strength. And if you're taking them longer, for a longer period of time, it can actually help. And if you're a person who likes to stay fit, you like to exercise, it can actually also complement the therapy you're taking or the medication you're taking, and therefore keep your body strong. Okay, so there's another notion as well that hormone replacement therapy acts as contraception. So they don't replace contraception, and they don't have the same, what can I say? They're not made of the same stuff that contraception might have. So in terms of the hormones that are inside the hormone replacement therapy, the doses are actually very, very low. Okay, so most contraception pills will contain synthetic hormones. So those are the ones that are not natural, which tend to have more risk compared to the hormone replacement therapy. All right, and the effects, therefore, they are not the same. So you can't classify them as the same thing. Yes, they might contain hormones, both of them, but the doses are lower, and the types of hormones that are inside each one of them are very different, and they don't prevent you from getting pregnant. So because you are on hormone replacement therapy, it doesn't mean you should come off contraception. It doesn't mean it's going to protect you from getting pregnant. It is not a contraceptive. So it's usually encouraged that you should continue using your contraception until the age of 55 at least. Okay, until the age of 55. Also, there is no evidence at the moment that that is out there that hormone replacement therapy is responsible for weight gain, and it does not increase your risk for type 2 diabetes. So if you already have type 2 diabetes, then hormone replacement therapy is unlikely to have any negative effect on your blood sugar control. So when you're deciding if hormone replacement therapy is suitable for you, your GP is always going to account for any health problems you have in relation to diabetes, and they may even need to ask to speak to a specialist before they prescribe you the treatment. Also, another thing, please be mindful that hormone replacement therapy, they do not cause fibroids, and they do not cause weight loss. So it's not going to be a quick fix for weight loss. What it does, it just makes you feel better So the symptoms that you may be experiencing, so maybe you can't sleep well, you're tired during the day because you didn't sleep, you're getting hot flashes, you're sweating, and all these other things. It helps with that, and therefore maybe you're getting better sleep if it's not working, and you're more energized during the day to cook a healthy meal, to exercise, and do the things that you need to do. So, as we previously mentioned, I'm just going to touch up on this again. There's some medications that your GP will have to add or to prescribe as well. So, for example, if hormone replacement therapy does not help to restore your sex life, they might offer you a testosterone gel or cream. Please note that it is not licensed, and your doctor should mention that and explains what that means. However, it is being still prescribed because it can help improve the sex drive, mood, and energy levels. And if you keep on getting the urinary tract infections, then they might need to discuss antibiotics with you, and they might suggest some other estrogen treatments that you can insert inside your vagina as a tablet, as a cream, or as a ring. So this can help with any dryfulness, any itchiness or pain down there, and it can also improve any urinary symptoms that are caused by menopause, or even when you're experiencing discomfort whilst you're peeing. Again, this is something we mentioned last time, that some antidepressants, it's something that your GP might talk to you about, but be mindful that they don't help with they cannot replace hormone replacement therapy. Okay, they might talk to you about high blood pressure and epilepsy medication to help with anxiety, depression, hot flashes, or mood changes. There are a lot of people that are being prescribed antidepressants instead of hormone replacement therapy. So again, this is why it may be important to seek advice, or to get a second opinion, or speak to a menopause specialist, because again, there are some things that maybe your GP might not get quite right. You might go to them and say, I've been experiencing mood changes, hot flashes, and this and that is changing. And instead of talking to you about hormone replacement therapy, maybe because of experience, maybe because of their beliefs and their values and what they think around hormone replacement therapy, they may just start off on antidepressants. But again, they're not meant to replace hormone replacement therapy. They might need to talk to you about sleeping tablets or remedies. Maybe you can speak that to your pharmacist to see what can help with sleep, so that you're more energized and more ready for work the next day. And also, again, if you're struggling with dryness, there's some non-hormonal lubricants and some creams that can help with that. So that's all I've had to talk to you about today, and I hope that clarifies all the things we have spoken about today.